We're currently in the middle of the largest cost of living crisis seen in at least a generation. It's exacerbated by conflict, climate change, and COVID. In addition, 1 in 20 of those who get COVID have been left with lingering problems with their heart or respiratory system, affecting their general well-being and leading to anxiety and depression. Many people have lost their jobs because of COVID, and the politicisation of responses to this difficult virus has led to the stigmatisation of groups of people and a lack of trust in authority, which acts as such a trigger for stress. COVID has also caused anxiety to those with chronic non-communicable illnesses, not being able to access the healthcare they need. And this comes on top of a fear of catching COVID or passing it on to our loved ones, and anxiety caused by society reopening, as well as the stress of being faced with new realities of working from home, of unemployment, of homeschooling of children, or of lack of physical contact with other family members, friends, and colleagues. All these factors, combined with the system disruptions caused by climate change and conflict, and their drivers of social and health inequalities, they have the greatest effect on those who are most vulnerable. They affect people's mental well-being. And without meaningful interventions, these impacts will worsen, placing even greater burdens on our health systems, and exacerbating inequalities. How we deal with all this now can either strengthen our societies or set us back in the progress that we need to make our societies equitable and durable. And that means we need a global response that focuses on the needs of those most vulnerable. And we need all people to be protected and prepare all our systems and all our communities to be more resilient. To assist with these kinds of challenges, COVID, conflict, cost and climate change, the United Nations has set up the Global Crisis Response Group on Food, Energy and Finance. But it's more than just thinking about these kinds of challenges. We need to focus on mental well-being, and at the recent Stockholm Plus 50 conference, the World Health Organization released a report on climate change and mental health. Governments everywhere are urged to include mental health in their response to the climate crisis, to develop community-based approaches to reduce vulnerabilities and to close the large funding gap that exists for mental health and for psychosocial support. You see, 50% of mental health problems are established before children are aged 14 and 75% before adolescents are 18. Children and adolescents are particularly vulnerable to negative mental health impacts of climate change, and they do need to be equipped with knowledge and skills to be able to lead themselves through this, lead themselves for their community, lead themselves for their organizations, lead the world. Advocacy by young people is particularly important in moving the needle for systems leadership. For interconnected crisis, you need interconnected solutions, and systems leaders know how to weave the different issues together and obtain and explain whole system responses, as well as focusing on their components. And young people are such vital agents of change. They can bring awareness, they can drive behavior change, they can engage with systems from multiple perspectives at the same time. They can appreciate the relationships between systems and their environment. They can feel the pace and the rhythm of systems and assess their readiness for change. And they are more likely to meet people where they are rather than where they would like them to be. You see, young people are ready to make these changes and to provide the systems leadership that's needed for the future. But they can only do so. They can only do so if they are able to function at the interface between climate and health. Both these incredibly important issues affect all of us individually and affect our communities. So in summary, climate change, combined with food shortage and conflict on top of COVID, is having an extreme impact on the mental health and well-being of people everywhere, and particularly those who are poor and who are vulnerable. And this is manifested in the interconnected problems that we experience today, and they need systems solutions from leaders who are systems thinkers and practitioners. And the mounting pressures and increasing triggers for mental ill health need collective attention now. Community-based approaches are required to provide mental health and psychosocial support to all people, but particularly those who are hard to reach, those who are poor and those who are vulnerable. Women, children, indigenous people, people of the land, people who are in migrant labouring positions, people who are least able to handle these stresses. They need to be the centre of our attention now. Thank you.